Rabies prophylaxis. Okay, we have a case here of a 30-year-old female patient who just got admitted for an archaeology PhD program. Yay! Where she can finally pursue her passion of investigating different caves in the US to further understand human interactions in the Stone Age. I actually have no idea if this is accurate, but the point is that she's going to be in caves a lot, okay? And she's saying that she's trying to take precautions because she's heard that there are bats in a lot of these US caves, okay? Then we have our second patient, who's a 40-year-old male who was hiking with his buddies when he got bit by a rabbit that looked very hyperactive and was foaming in its mouth. You're seeing him at the ED after the wounds have been cleaned and the patient is stabilized. He's doing okay. But now, both of you wonder, does he have to be treated for the exposure of rabies? A little bit about rabies. Although this video is just about the rabies prophylaxis and the different scenarios where we may have to use them, it's good to recall that rabies is from the family of the Rhabdoviridae virus, and the way it's transmitted is through bites, okay? Through the bites and saliva of an animal who has been infected with rabies. And nationally, in the United States, most rabies reservoirs are bats, and in the rest of the world, especially in developing countries, it's mostly in wild, undomesticated animals like wild dogs. Okay, so just keep that in mind. So what happens is that when an animal with rabies bites an individual, they have exposure to the mucous membranes of that animal to that patient. Okay, so the virus in the saliva and the mucous membrane of that animal gets into the nerves, the peripheral nerves of that patient, and then it travels from the peripheral nerves right up to the central nervous system, which includes the brain and the spinal cord. So that's why in patients with rabies, you can see encephalitic symptoms, you know. But the incubation period of rabies is about 4 to 12 weeks. So you don't see the symptoms of rabies as soon as the patient has been bit. You don't see it until about 4 to 12 weeks, basically, a whole month to 3 months. So, and when you see them, it's like, it's lethal, basically. You don't want to see the symptoms of rabies. And that's why it's very important to have vaccinations against rabies if you have been exposed to it or if there's a high risk of you ever being exposed to it. So the symptoms of rabies include flu-like symptoms, weakness, feeling irritable, low-grade fever, sore throat, headache, nausea, vomiting, and then even, a patient having a coma, um, presenting kind of weird, abnormal behavior, because again, it gets to the brain, and which is part of the central nervous system, and it could even lead to respiratory failure, lead to a coma and a death. So it can get very lethal once you start to see symptoms. And then the symptoms of rabies are so non-specific. Many things can make you present with the flu-like symptoms, even the flu, and of recent COVID-19. So if there's any chance of being exposed to rabies, either one is in a place where they're exposed to many animals that have the chance of being a rabies reservoir, or they've been bit by an animal that is a high risk of having rabies. It's important to get what we call pre-exposure or post-exposure prophylaxis, and that's the point of this video. So in our first case, which is our PhD student who will be going into many caves in the US that have lots of bats, she has a chance of encountering a bat and probably being scratched or bitten by one. So we want to give her pre-exposure prophylaxis before she has been exposed. It's not needed in the general population. It's not part of your childhood vaccines that you have to take. We only give it to people who have a high risk of being exposed to rabies. So veterinarians, your animal doctors, veterinary students, people who catch um, animals that are stray and just wandering about in the streets, people who will be investigating in caves or in areas where there's a high endemic of rabies. So we want to give those patients pre-exposure prophylaxis before they even encounter the animal. So that's usually a vaccine, a shot in the arm on day 0 day 7, and day 21 or 28. Pretty simple, okay? And our second guy here, um, who was hiking with his buddies and actually got bit by an animal. There are a few questions you want to ask. Is this animal high risk of having rabies? So it's not everyone that gets bit by their pet that will have to come in for a rabies shot, right? Ask ourselves, is the animal high risk or low risk? Or is the animal um, a dog or a cat or a ferret? You need to consider the kind of animal that actually bit the patient, you know? So low risk wild animals include bunnies, chipmunks, squirrels, mouse, rat. Usually they're small, cute, and furry. And then high risk wild animals include bats, raccoons, skunks, fox, woodchucks, and the likes, okay? But this case in this example is a little tricky because we had a nice cute bunny, but was foaming in its mouth, hyperactive, and quite aggressive. That bunny probably has rabies, okay? Even though it's a low risk wild animal, all right? So we want to ask that question. If the animal is high risk and wild, then we want to ask, is the animal available to be tested, correct? So is the animal available to be tested? If we can test the animal, we still want to give the post-exposure prophylaxis in this case to the patient. You know, we want to get that going. And by the time the results of the animal is back and the animal tested negative for rabies, we can go ahead and stop the post-exposure prophylaxis if the test is negative and the animal is not rabid. Okay. But if the animal is rabid, then obviously we continue the post-exposure prophylaxis. If the animal is not available to be tested whatsoever, we still want to test, we still want to give the patient the post-exposure prophylaxis because again, rabies is lethal and we don't want to give that to chance. The other questions we want to consider to know what type of post-exposure prophylaxis to give the patient is if the patient was actually vaccinated before, right? If this guy here was maybe like our PhD student who already came in to take a pre-exposure vaccine and then got bitten by a rabid animal, then the type of post-exposure prophylaxis we give this guy here will be a little different if as compared to what we'll give him if he hadn't had the vaccine before. So if the patient has never been immunized before, then we give the vaccine on day 0, day 3, day 7, and 14, as well as immunoglobulin on day 0. Okay. So what we're doing here is basically attacking or supporting the immune system of the patient to attack the virus two different ways by active immunization by giving the vaccine, okay, to the patient, and then by passive immunization by giving immunoglobulins to the patient, okay. So on the first day, day 0, we give both vaccine and immunoglobulins, and then on day 3, 7, and 14, we go ahead and just give the rest of the vaccines. If the patient has been vaccinated before, so they had the pre-exposure prophylaxis before, then we only need to give the vaccine on day 0 and 3. No need for immunoglobulins. Okay. So in summary, for rabies prophylaxis, there's a pre-exposure prophylaxis and then there's a post-exposure prophylaxis. The pre-exposure prophylaxis is not for everyone, only for people that are high risk of being exposed to animals that could potentially pass rabies on. Like I mentioned previously, based on their occupation as veterinarians, veterinary students, or patients that work a lot with wild animals. And they're given the vaccine on day 0, 7, 21, or 28. No need for immunoglobulins. For post-exposure prophylaxis, that is someone who has been bit or exposed to an animal that has a high risk of passing rabies on to the patient. If the patient has never been immunized, then we give the vaccine and immunoglobulin on day 0 and go ahead and finish up the vaccine course on day 3, 7, and 14. If the patient had been immunized prior, then we only need to give the vaccine on day 0 and 3, and we don't need to give the rabies immunoglobulin. I hope this was helpful. If you'd like to ask any questions or anything is not clear, please feel free to drop your comments in the comment section. Thank you.